So I'm a nurse anesthetist. I've been a nurse anesthetist for 25 years. I've worked in all of the large Metro Detroit hospitals and done some travel work even. I started doing dental sedation, I would say about 20 years ago. And then in 2014, I moved to doing it full-time. I was doing a little hospital work, and now this is what I do exclusively. So I go all over Detroit, working at many different offices, and that's all I do is give dental sedation. So I come here and work with the people here at least once a week, sometimes more often. Initially, the patient would receive a phone call from our nurse, Liz, and Liz would review your health history, all your medications, all your surgeries, go through all those questions, and she would explain what the day would look like. She'll talk about your anxiety levels, whether or not some people would like an oral sedative when they come in that day, even to get into the door, depending on how anxious they are. Some people don't need that. And then when you get here that day, I would review that information with you. There's a few questions I would go over. We'd sign consent forms. I would answer any questions that you had about sedation first. For you and the person that's giving you a ride, the person that's going to be with you afterwards. So once that is done, we walk back to the chair, I get monitors on, I start an IV, and basically that's all the discomfort that you would have to go through. So after the IV's in, you don't feel any pokes, no pain, no anxiety. It is a heavy, heavy sedation. So I always warn people, you may be aware of us talking and working, but I guarantee no pain. I guarantee no anxiety. And when people leave, they're actually still a little bit groggy. When they leave, they're a little forgetful, a little out of it. They might be numb where we worked. They might have some gauzes going on. They just go home, take a nap. And then once that nap is done, you start eating, you start your medication regimen, which we've already reviewed before the procedure. And then you go from there. And that evening, you can expect a call from me or one of my other anesthesia providers. Again, answering any questions you might have, just checking in to make sure things are going well for you that night.